Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 ATH Alice. Welcome to another Tuesday show. This is our Tuesday show. Abby Tyler's Healthy Living page. My name is Abby. I am your host, family nurse practitioner, and welcome to the Tuesday show. If you're not a member of Abby Tyler's Healthy Living page, please hit the like and follow button. Please I like to share the show. Trying to raise some money to put some stuff. So you send me stars, but if you can, again, like I always say, please just go ahead and share the show, invite others as well. Okay. And again, also my disclaimer. I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay, so with that being said, today's topic is warning signs to call when to call your child's doctor. As you guys know, I'm a family nurse practitioner. I talk a lot about adult stuff, and every once in a while, I go back to family to pediatric stuff, children's stuff, and all that too. So I cover everything. I work with mostly adult patients and all that too, but I cover all of that, and that's part of my training. So, without any further ado, again, please share the show. Please share the show. Welcome to all of you who are joining me from YouTube, from Abby Tyler's Healthy Living the group, Abby Tyler's Healthy Living page, Focus on Liberia, and wherever else we're going to be streaming to. And for those of you joining me now, I say thank you. For those who will be joining me later, I say thank you as well. Okay, so at this time now, as parents and all that too, you guys know that how difficult it can be when you have a child that's sick and you have maybe you got more than one child, and when they come, especially this time of the year, they're catching everything from the cold to COVID to stomach flu, and you're like, oh my goodness. And I see a lot of videos that said these kids were home all summer long. They weren't sick. As soon as they go back to school, that's when they start saying everything else is wrong with them. So and which is normal because when they're home, they're among only just their family members and small group of friends. But when they're in school, they're there with like 500 or however big the school is, other children, and they're breathing in the same air and they're touching the same thing, especially when they're much younger, and they're touching their faces and all that too. So they're not washing their hands every time in between because it's difficult to wash your hands all through. So, so sometimes it can be, and then they get sick. So sometimes it can be a little difficult for parents to decide, like, okay, do I keep them home? And I can just call in and go on from there. So I did do a show on when to go take them to the family doctor, to the pediatrician, or if you all go to the same doctor, or to urgent care and also the emergency room. Okay, so this is just like a little short show today about when to call and when, because sometimes it's like, do I take off from work? My husband take off from work. If you're a single parent, if you have more than one child and all that too, it can be a little bit cumbersome. So let's get right into it. Okay. So, what are some of the warning signs that you have to look for? Let me just get to my manners here. Okay. Alrighty, so let's get into it. The warning signs, okay? If you have, especially if you have children that are younger than infants, especially some infants will be anybody younger than 1 year old, okay? But especially like the 3 months old and all that too. So they're pretty young at that time. Any kind of fever that's like 100.4, especially under three. Anything higher than that, usually some doctors have a little leeway. But if they're that young and all, because you'll be seeing a doctor usually like every month during this time, like the week after they leave the hospital, and like a month and two and all that, depending on the doctor's schedule. So you want to call, okay? Say I have something going on. They're feeling hot and all that, and I'm a little this is Fahrenheit, by the way. So if you have to convert it to Celsius, you can go ahead. Most thermometers have that too now, okay? And you're going to be taking that on the tongue, or you can do that on the arm and all that. So when you tell them, when you call you the doctor's office, you say, yes, I took it under the arm, or I took it in the mouth, or maybe the one that you don't have to touch of it, because most places have the one where you just scan the forehead now, especially because of COVID in the past couple of years has had the non-touch one. So tell them exactly where you took the temperature, so that way, because if you take it, let's say you can also take it in the rectum too. I don't advise that when you're doing it at home and all, because that can cause some injuries if you're not one of those people who are trained to do it. So just tell them what you took it in, because sometimes we have to add another degree to wherever you took the temperature from. So let's say if you took it like under the arm, you have to, if it's 98.6, it's going to be 99.6. So tell the doctor, I took the temperature under the arm and this is what I got. So that way we start doing that. Okay. We start knowing right away that, okay, yeah, this temperature is a little higher than what it is. And you know your baby and all that too. So you know your children. So you know when they're sick, you know how different they can be. Okay, so go into here. If they have a fever, if they have a fever along with symptoms like stiff neck, especially like stiff neck, and they're just laying around, stiff neck, extremely sore throat, ear pain, rash, severe headache, call. All right. Any breathing problem, you know that when you want to send them directly to the emergency room. If you see them breathing, like trying really hard to catch their breath, or they're like sometimes they're breathing in between the breathing, and then you see the pausing, and then they're breathing again. Call 911, get into the hospital. Labor breathing, noisy breathing, especially you find if they're all congested and you know they're not breathing the way they're supposed to be breathing. Again, like usually we tell people, you know your child and you know how their regular breathing is. We know what the regular breathing is supposed to be, but you know your child needs to. Okay, maybe that one snores a little bit, or when they breathe a little heavy because they have other issues. But it's a little different, and you want to describe that. Be as descriptive as possible. But anything that has to do with breathing, you want to take them directly to the emergency room. Okay, and for state of this, the reason of this show, if they have other pre-existing issues, illnesses like asthma, or cerebral palsy, or anything else, any other neurological diseases, like they had seizures before, other things that they have that makes it a little difficult, that makes that you and your pediatrician or your child, your doctor, if you all see the same doctor, that say, okay, because they have these pre-existing conditions, so if there's something that's different from that, I want you to call right away. That's different. We're talking about just children who don't have all those things, but in addition to, if they have that, any kind of breathing problems, you want to take them to the emergency room. Okay, so let's get into that. Again, persistent pain, such as sore throat, ear ache, and all, because little kids get ear infections so often and all that, because like eardrums are so small, and you need to take them to emergency room, take them to call the doctor's office first. It also depends on your insurance too and all that, because they'll be like, okay, they just had like a little ear pain and you took them to the emergency room. And sometimes you don't want to take them to the emergency room and you don't have to be there, because you're sitting there and you're going to be there for like 5, 6 hours and all, because they're going to be seeing the ones that have breathing issues and heart issues and all that too before they see somebody with an ear infection. So call the doctor's office, call as early as possible. And some doctors do, when they tell you, call them, and so they'll call you back within an hour or so, or 30 minutes or so, depending on how, when you tell the answering service. All right. And then they tell you, make sure you turn off, we'll be calling you back without our their caller ID. So if you see a private number, answer the phone, because I know there have been times where even when I have my patients, I say, I'll be calling you back. My caller ID will be blocked. And then they don't answer the phone. And it's like, okay, so make sure, because we're not just going to put our phone numbers out there already. Any kind of discharge from the eyes, if it's like thick and yellowish or brown or tannish and all that, because you're talking about conjunctivitis, which you call pink eye, which you call Apollo back home. Okay, and it's sticking to the eye in the morning, you wipe it off, and it's still not going away the rest of the day. Call, all right, and especially when it starts saying you feel like sand in my eye, it feels so and so painful and all. Make sure you call. Alrighty. Any kind of vomiting, they're not keeping the food down, they're not keeping the liquid down, and especially vomiting, like nausea, vomiting, all that, because the more they vomit, you're going to be losing all your minerals and all of that, all your electrolyte, your potassium, your salt, all of that, sodium, and all of that. That's can be very dangerous, because when you're losing all of that magnesium, when you're losing all that from vomiting and diarrhea, eventually you're going to pass out, because the body cannot function without all those things. So it's important you calling them and say, yes, they've been vomiting all day, or they've been vomiting, and how many times have they vomited? Did you give them anything to drink? Are they holding it down? If you give them something light to eat, let's say, okay, we'll tell you do the bread diet, the banana, rice, applesauce, and toast. No, they're not keeping that down, and nothing's going on. They're complaining of stomach pain. And also, we might ask you too, what part of the stomach are they complaining of pain? Okay, because if it's something, oh, well, it's the pain, it's in the upper right corner. We're talking about something that maybe there's something going on with the gallbladder. They're talking about my lower right corner, like right below on the right side. We're talking about appendicitis. On the other side is your this is the side that we really want to get to, okay? So your pancreas and everything's on the other side, and your spleen is on the other side. So we'll be asking you those things. So and sometimes you'd be like, no, they just complain of pain all over. It's just really miserable. Okay, so we're not gonna be like, oh no, you have to be particular about which side, but it just because the fact that when we ask you those questions, it means like, okay, get them to the emergency room right away, or let's see if we can get him any kind of medication that's gonna make it go away, or that's gonna manage it until I see them in the office the next day. okay, or take them to urgent care. Some urgent care centers are open like 24 hours too. So we can might say take them there. The urgent care will see them for a little bit and then tell them, okay, this is what we're going to give you some medications, and then take them over to you can see a family doctor tomorrow. Sometimes you go to the urgent care centers, and the urgent care center will be like, take them to the emergency room. If they think it's something really, really serious that needs emergent care, take them right away to the emergency room. Don't even bother doing all that. Just take them right away. Okay. Dehydration too, because they have been vomiting. Again, that goes along with the vomiting and diarrhea and all that. If they've been vomiting all day long and you see them just laying around, and it's this child that likes moving around and having a good old time, and or like even if they're sick, some kids when they're sick they can still move around, because sometimes the parents would be like, oh, you said you had your stomach was hurting, but yeah, you are watching TV and dancing and doing your TikTok, but it's so they can get the symptoms are not bad, they can manage it, they just can be at school or be at some function or stuff like that. But if they're just laying around and not moving around, you'd be like, this is a little different. This is a little different. So, I'm going to call and we'll be asking you all those questions too. So have all those answers ready when you're ready to go. And of course, you're going to be panicking too. So we're not going to be holding you to exact answers, but those are the main things that we're going to be asking you, that because sometimes you get the answering service. And then when you get the doctor or the provider on the phone, we'll be asking you many more questions than that. So it's important to do. And some doctors also have telehealth too. So if I'm looking like this, you're on your phone or you're on your computer, you can have the child sitting right there and the doctor can look directly at the child too, right? So ask your doctor's office or your pediatrician's office if they have those resources or services available. Alrighty. Any kind of vomit or diarrhea that has blood in it, any kind of vomit or diarrhea or that has blood in it, that is like red alert, red alert, red alert. You want to make sure you explain that. Don't just leave that part out. It's very important. And then of course you want to go to the emergency room for that. Okay. Any stiff neck, again, extreme lack of energy, and if they were feeling a little better this morning, because sometimes it takes a little while for whatever they're going through the body to fight it, because the immune system's like, okay, I'm coming up, just something attacking us, we need to fight it. So it might take a little couple of days or so for it to get there. Again, not for really very really really young children. Okay, so it might take a little while, but then if it doesn't seem to be going away, because say you say, okay, we're watch and wait, but it doesn't seem to be going away, of course you want to call already. So again, it seems to be getting worse, or rather staying the same. They're not getting any better for more than 3 to 4 days. And exposure to if they had people who had COVID around them too, and they seem to be getting sicker. Again, if they got the vaccine, and younger, much younger children, I think it's for like 5 or up now. But if they didn't get the vaccine, but even if they did and all that, you still want to get checked, because also different things, chicken pox, if you see any kind of little spots in the body, little look like chick pox that's all over the body, and or anything with the tongue, any kind of rash, call, okay? Because you want to make sure it's not like measles and against like chicken pox, where all the other children in the school or children who live at home could get really sick, and you have an elderly relative, because some people have their relatives, older relatives living with them too. So you have to protect them as well, because something that can be, something that a little child can kind of manage and get over, that can be very deadly to an older person too, because their immune system has gone through everything else and is not as effective as the one younger children who's immature, and the other one's like much older now, so it's not, they can't fight off certain diseases the way they used to when they were younger. So when you have generations of people living in the house, it's important to make sure that you keep everybody safe. All right. And any kind of illness that if you just came from out of the country, regardless of where you went to. So I'm not going to say, okay, yeah, you came from a developing country, or any. I think there was a young kid that last year that had just come from back home, and he got sick and all that too, and I think he was, unfortunately, he passed away. I don't remember the whole story, but if you just traveled, especially if you just travel and you come back and say, yes, they came back and they're just laying around, they complain of headache, they complain of anything, they're vomiting and all that, and that being out of the country and all, go to the emergency room, because then again, then we'll deal with much more. It may not be as serious, but it's important for you to make your provider aware of that. Okay. And any kind of urinary problem, and also they're having pee all day long. Okay, they're having like the diarrhea that I talked, but they're having pee, especially for your babies. They're supposed to have like at least 10 to 12 wet diapers a day, and you notice that they're having like the diapers being dry. Don't say, oh yeah, okay, but they're not, not peeing. No, if the diapers being dry all day, or the younger ones say, I'm not peeing that much, or if I go pee, it burns a lot. Go make sure you call already. And for younger and and if they have a seizure. Now there's different kind of seizures. You can have a seizure where it's like you literally just sitting there and look at, and if that's going on with your child, regardless of all of this, just staring blankly into like just into nothing. Alrighty. So it's like, okay, we're talking petite mal seizure, we talk a grand mal seizure where it's like everything starts shaking on them. They could literally pass out when they fall on the ground and pass out. If they have history of seizures, also you by now you should know everything what you're supposed to be doing. But if that happens, make sure you're not putting anything in their mouth because it could be biting something there. Just lay them on the side. If they've never had a seizure before, take them to the emergency room. Okay. Talk to your doctor too if they have anything. What they just sitting there staring into space. I know this person is staring into space every once in a while. I don't know what's going on. Bring that to your doctor's attention because if you're having like a petite mal seizure where that could, go on to be something worse than that. So it's important. Okay. So bring that to attention. They may need more neurological testing for that. All right. So and make sure again, like I said, you're feeding them. They're not keeping anything down. That nausea, vomiting, stomach pain, fever that's lasting for a long time. And if they are responsive, if you hit them and knock them and all that too, and then 911, just stick them. Don't even bother. Just 911. Don't say I'm going to put it in the car and take them, but depending on what country you're in and all that too. But call 911, take them because again, when 911 comes, they have to put an IV needle in there, do EKG, to do everything else that paramedics are trained to do. When you're sitting there, when you have that person in your car, you're stopping at every light or you're driving the speed limit and all. Minutes. Like I always said, time equals tissue. Time equals tissue. You don't want anything that's going to cause any kind of brain problem later on. And because you got there so late, and by the time you got them out of the car and got them, no. So call 911 and get them to the emergency room as soon as possible. Okay. So let me just see here. And also for boys, so I wanted to talk about this. If you have a son that's complaining of pain, severe pain in his testicles, okay, the testicles, the penis and the testicles, alrighty. So if they're complaining of severe pain, like really severe pain and all, get them to the emergency room as soon as possible because it's called testicular torsion, where it's like the blood vessels in there, it's like all twist up and all. And within a certain amount of hours, if they're not there and getting that ultrasound and getting all the treatment they need right away, they could lose that whole testicles and one testicle and all that. And that can also, when as they get older, that can also cause problem with like trying to get pregnant, trying to get somebody pregnant and all that. Okay, but not only that, too, it's like then they have to go through all the reconstructive surgery, but everything else that can happen from that. So please, if they complain of severe pain, take them. All right. And I'm just going to check here. Hope you guys are giving me and you like it. Let me just check here and see. Oh, take time how to talk now. This is right for the African people. Oh, who's that? Okay. Alrighty. Okay. And so I'm going to let me just so we're gonna go in here and some of the things that you can do to help your child too and all that too. So you get a warning signs, and again, it's not all conclusive. So there may be other things that I've left out, but I'm trying to hit the most important one. Again, going back to the fact that if they have pre-existing conditions and all, you want to. It's good to always establish care with the pediatrician, or the family doctor and all that, so that way anything happens, they can just open up your chart. The doctors were home. We had the computers and all that too. We can just open up the computer and look at the medical records and all. Okay. So let me just go in here for a second. I'm just gonna just take a 1 minute break and then we'll be right back. Thanks for joining me. Alrighty. So Okay, welcome back. Welcome back. Okay, so I will go in here. So our next thing is vaccination. If you're just joining me, my name is Abby Tyler. I'm your host. This is Abby Tyler's Healthy Living page. Today's topic is warning signs to call your child's doctor, the pediatrician, things to watch out for. Okay, so I went over, if you can go back and review the other part of the show's over. I talked about the warning signs to look for. Okay, so now we're going to be talking about vaccinations. All right. I know vaccinating prevention. I know vaccination is a hot topic. Some people, oh, I'm not giving my child this vaccination because they say it causes this one causes that. That's something you're going to have. This a conversation you're going to have with your child's pediatrician. Also, depending on the school district that you live into, they might say, don't bring your child to school if they haven't had this Medicaid, they haven't had this vaccination, they haven't had that vaccination. All right. So that's the conversation for you and your child's provider. I'm not getting to that. I'm just giving the information today already. So it's important that and your children, especially like 6 months old, they have the flu spray, but that's just for really young children. Also, some pediatricians don't like to do that anymore, so they want to give this shot. I know the shot can be a little bit upsetting for little kids and all that too, but and you tell them to go into the doctor's office, they know right away they're gonna get a shot. It's not always they don't always have to get a shot, alrighty. But you can get that little lollipop, take that little, especially take their video games. You can give them their phone so they be playing the video games. You can give them the little doll baby, just anything that's going to distract them and then promise something for them to, because, it's like, I don't like getting shots and I'm grown. So, but it's important. All right. So make sure they get their flu shots and all that. Make sure they're up to date with all the other preventive shots too, especially when they're very young. That first year when they go seeing the pediatrician, they'll also make sure they're up to date with all their shots and all the preventative shots too, so they don't go to school. And because when your kids, especially if they have pre-existing conditions too, and some of them the flu or they get pneumonia, that can lay them in the hospital for a very long time. Even though you think like, oh yeah, they're stronger than somebody who's much older, doesn't matter. It can land them in the hospital for a very long time. So it's important that you talk to your pediatrician and get them medications, get all the shots it's supposed to get, because especially for school, before you even get to the school, they're going to be asking you for all that too, right? And for college students too, don't I'm talking my children now. For college students, when they go away, they're going to be in a dorm and all that, so they need all the shots before they go away too. Alrighty, so it's important. Again, like I said, a flu or pneumonia can cause some serious complications for children who already have like breathing issues. Already, again, like I said, with asthma and anything else that goes along with that. So something that can be very normal for you that can land in the hospital for a long, long time. Alrighty. So the most important thing, make sure you're washing your hands, making sure you ask them when you do take them to the doctor's office too. And some doctor's office, like my kids when they were younger, the pediatrician, they had like the kids who were just coming there for the well office visits, and then the one who were really sick, they had two different waiting rooms too. So that's important because you might say, okay, especially if your child's vomiting, you're not going to bring them over there. So, and they'll ask you all those questions before bringing them into. And then also not because of COVID, also because the fact that, okay, there's anything going on with them, they can literally just stay in the car. You and them, they can stay in the car. And then when they call them, they can just go right into the doctor's office. They don't have to sit in there and be miserable. So they can be laying back in the car and relaxing until they call them too. Okay. So actually ask them too if they have those services available, because now everybody has that. All right, and making sure you're washing again the gloves and washing the gloves. If you can wash the coats, wash the coats. If the coats can be washed, put it in the dryer, because it can kill all the bacteria and the viruses and everything that they pick up from back and forth touching each other stuff and all. Making sure you're cleaning out all the surfaces, your doorknobs, the faucets, the toilet, everything. Make sure you're cleaning that down very regular, especially during this time of the year. And one more thing, if you have hand sanitizers, making sure you're looking at the hand sanitizer, because it expires 1 year and in 2 years. Okay, so it's like it's good for 2 years. Check and see the expiration date on your hand sanitizers, because if it's expired, it's not going to be doing you any good. All right. So what you can do for home care. So we talked about home care already. So make sure your child gets plenty of rest and fluids and all that. So just let them rest. Okay. They're eating, their bodies like fighting it. So just let them rest. I know some of them you say, okay, you're home and you can do some chores. Just let them rest. Okay. Let them get enough fluids and rest. If they're vomiting, again, like I said, the bread diet, banana, rice, applesauce, and toast, you can do that. And rice, not rice with like soup and all, but like maybe some rice with butter. Okay. Because you don't want anything that's going to be upsetting to the stomach lining there. And dry toast with butter too. All right, and before giving it any kind of medication, or you, of course, because some people say, I would just take a little bit. What I take half of that and give it to my child. No, don't. Also, do not give antibiotic that was left over to your child, because that's most of the children we give antibiotics to. We have to weigh them. It's according to their weight, and they may be allergic to something that you're not allergic to, and you're not supposed to be sharing antibiotics with anybody, anyways. Okay, so please do not share give them any medication, even if it's like a cough medicine or something. Check first with your pediatrician before giving that. All right. So get this steak and I have this here. Can I give that to them? Alrighty. So some of the schools and all, you may say, okay, not time for them to go back to school. So I need them, I have to go back to work. I can't be sitting here. I can't afford to stay home. All right. So some of the schools will tell you the child shouldn't have any fever greater than over 100.4 for 24 hours. Okay. No vomiting or diarrhea for 24 hours. And if they're on antibiotics, they have to be on it for at least 24 hours to 24 to 48 hours before you can bring them back. If they have pink eye, that's got to be completely cleared out before you can bring them, because it's highly, 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 transmissible to somebody else. So please do not bring them to the place. And I understand, again, like I said, being a parent myself, when you're younger, you have to sit there and be like, okay, what am I going to do? I have to go back to work. Okay, so those are some of the things you got to be talking about, and really have to lean on your support system. But sometimes your support system might say, well, don't bring them to my house. I have small children here, or I have an older person here. So talk about it, okay? And have some really good friends that you can lean on. All right. And if your child's in the grade and you say, okay, go back to school, you're better now, go back to school. If the child's still in a lot of pain, even if they're just faking it or just like, I want to be home, just let them rest for one more day. That thing we used to do about being perfect attendance and all that too. Some people still follow that, but if your child's sick, like when they're 24 years old, who's going to care whether they have perfect attendance all through school? For some people it's like, they like that. Other people are like, no, I'm good. Okay. So if the child has, fever, make sure you're not giving them aspirin. Do not give them aspirin. Do not give them aspirin. Do not give them aspirin. Okay. Give them Rye syndrome. That's a really serious disease. Do not give them aspirin. No child is supposed to get aspirin. Baby aspirin or whatever. Do not give aspirin already. And do not mix up too many different cold medicines. Oh, I can do this, I can do that, and put it together. No, because then when you call, it would say, what have you given them? Oh, I mix this up. I mix this up. I mix this one up. No, don't mix it up, because also the child could have an allergic reaction, or it could be so potent that you could cause much more serious problems. So it's important that you talk to your doctor first, all right? And again, don't go put them in when you cover, guys. Sometimes it'd be like you have to feed the cold, where you have to cover them up in a warm blanket, and especially if they have a fever and all, just don't wrap them up so much and all, because the fever has to break. And so light blanket, nice enough to keep them nice and snug, but don't wrap them up completely, because you're just going to keep that fever in. Already. And ask your doc again. Let's say, okay, now she ready to go back to school. Can I take them back? High persistent. The doctor's going to ask you higher persistent fever, excessive fatigue, where they just laying around. Okay, rashes that can be contagious. Like I said, difficulty breathing. Of course, you're not going to take them back to school. Frequent cough, and if you have children here, right away any medication that a child has to take at school, that has to be authorized through the paperwork and everything with the school nurse. So you can't say, go ahead and take this Robitussin to school, and you can just take that when you need it. You could put yourself in some big trouble. Okay, I think they had one where this little kid took their mother preparation age, that's for hemorrhoids, okay, and took it to school, and all these little kids were like sharing it. So so it's important that you have that first, and tell the child, yes, you have to take this. Call the school. How do I fill up the form that they need that medication when they go to school? Alrighty. And also for COVID too, you watch out there. Again, get your vaccine. If you can't get the vaccine, that's something, that's a conversation you want to have with your own provider. I'm not getting into all the different things and all that. And also, I just wanted to add, with all the different things that are going on in the world right now, the uncertainty and everything that's going on in the Middle East, and some kids, you might think they're not paying attention to it, but regardless of what side are you on, and you cannot block your kids from watching TV, or they're on their phone and they're watching this. It's everywhere. Okay. And some of them would be really scared and don't know how to process all that. That's why I said before, make sure you're telling them based on their age level and all. And it has to be age appropriate, because you'd be like, okay, this one is bad and that one is bad. But all they see is pain. They see suffering, they see this, and they don't know. They cannot process all that right now. There were times where I used to sit there and think like, okay, my son was not, or my daughter was not paying attention to TV. I still remember way back when, I think when Michael Jackson died, and they were, I think they had Dr. Murray, who did the whatever he did, and they had him on trial, and they talked about it. We were watching the trial, and I think a back play, and I think they say he went to jail for like two. He was going to go to jail for 2 years, and my son was must have been about 5 at the time, and he went to bed, and I'm sitting there, and I walk by his room, and he's crying, and I'm like, "Why are you crying?" He's like, "Oh, I'm crying because I didn't want Murray to go to jail." I'm like, "Who's Murray?" He's like, "Oh, no, the person who did something bad to Michael Jackson." I said, and you won't think that he would be like, a child would be processing stuff like that. I said, well, he did something bad to Michael Jackson, and Michael Jackson's mom is sad, so he's just going to go to jail for a little while, and he's going to come out, and hopefully he will learn that what he did was wrong. So they pick up things like that. You think that they're not picking up, and they process it differently. So it's important that even what it is that you talk in the house, like I said, whatever side are you on, okay, you're talking about it and around and all that too. They don't understand the gravity of this. They don't understand the complexities of everything that's going on. So it's very, very, very important that you talk to them in a child appropriate manner, and don't scare them into saying, okay, this is that, and all that. And if you have any issues with it, you can always call your child's school and speak to the guidance counselor. They have people there who can explain things to them in a way where that they understand, that there's not going to say, okay, this person is wrong, this person this and all. They can stay right in the middle there and try to keep them safe, because the most important is to make sure that they know that they're safe and all, and they can still have empathy, but to know that they are safe from that. Okay, because trust me, I'm like grown up and all, and it's like I'm walking around thinking, how we walking around so okay, and there's like all this stuff going on in the other part of the world. Okay, so even for us, some people who don't know too much about it, we're still processing ourselves too. So just imagine these little ones who don't know what's going on. So it's very important. Even when my son was 10 years old, he came on one day like, oh my God, the government's going to shut down. I'm like, why are you worrying about things like that? Okay, so he was always the one who like said they're immersed himself in so many different things. And my daughter was my little flower child who just kept him calm and comforted him and all that too. So it's important. You know your children. You know what your children are capable of. Certain child, one child will be like, that doesn't bother me as much, and this child will absorb all of that. So it's important that you know that. Okay. So just to go back to everything, again, want to call your child's doctor. Like again, fever, vomiting, diarrhea if they're not peeing, severe pain, especially when they're complaining of soreness underneath here, over here, especially that too, stomach pain, and problems breathing. If they have a seizure and they never had one before, that's so very important to call your child's pediatrician and ask if you can come in, or they will tell you whether to go to emergency room. Any kind of breathing issues, you want to go directly to the emergency room. Seizure, you want to go to the emergency room and all that. Okay. So I thank you all for watching. Let's continue the comments in the continue conversation in the comments section. Alrighty. So I usually go back and read the comments, and I also respond to them. So if you have any questions after this, just leave that in the comment section and I will get to it. So thank you all for watching. For those of you watching now, I say thank you. For those of you who will be watching later, I say thank you as well. For those of you who have not liked and followed Abby Tyler's Healthy Living page, I am on Tuesday at 7 p.m. Eastern, and I do my daily shows during the week. It's about 30 little reel here, 90 seconds. So if you on Abby Tyler's Healthy Living page, you get to see it. All righty. So thank you all, and please share the show. And thank you all for watching. Thank you all for your love and support to all my new followers. Thank you very much. Of those of you who have shared my videos, thank you very much. You all have a beautiful night, decent night. Stay safe, stay healthy, and I will see you again. Bye bye. God bless.